Hello, thank you for watching and thank you for caring about having good health. I'm Jeff Riddle with the Natural Health Advisory Institute, and today I'm here in Dallas, Texas with Dr. Kate Naumes, who is a naturopathic doctor, and you focus on women's health mostly, correct?
Correct.
Right. Today we're going to be talking about Polycystic Ovary Syndrome, or PCOS, which may sound like kind of an obscure, strange thing, but it's actually something you encounter very frequently with women, and a lot of women may not actually know that they even have it. So what are some signs and symptoms of PCOS?
Abnormal body hair growth. So noticing hair around your nipples or your belly button that didn't used to be there. Thinning of your scalp hair. Abnormal menstrual cycles. Instead of having a menstrual cycle every 30 days, all of a sudden you're skipping 2 or 3 of them. Obesity or difficulty losing weight. Those are all symptoms that women come in with and are classic PCOS symptoms.
And how commonly do they come in to see you?
Well, since my practice focuses on women's health in the childbearing years, and PCOS is the #1 cause of infertility in this country, I see a lot of PCOS clients.
Okay. Do they usually know that they have it, or is this something that you have to educate people about?
I'd say about 50-50. When they have a great OB-GYN, they come in already diagnosed with PCOS, and then they want help with natural therapies to improve their symptoms and to get pregnant or to have more menstrual cycles. And then the other half of the time, they're wondering, why aren't I having normal menstrual cycles? Why is it so hard for me to lose weight even when I eat really healthy and exercise every day? And those are the ones that I spend a lot of time educating.
Okay. Does it get misdiagnosed a lot of times?
It gets missed. I wouldn't say it gets misdiagnosed, it gets missed. Or PCOS often seems to go with hypothyroidism. And so the hypothyroidism gets diagnosed, but there's a second diagnosis that hasn't yet been identified.
Okay. So especially with women, hormones and the proper hormone balance has a lot of different types of bodily effects. So can you talk about a little bit about the basic hormones for women?
Yeah. So we have a menstrual cycle every month if we're a healthy menstruating female. And our menstrual cycle is this beautiful kind of rhythmic pattern. So the first half of our cycle is called the follicular phase, and it's the estrogen dominant phase. And then we ovulate about mid-cycle, and then we have the progesterone dominant phase, which is the luteal phase. So every month we are supposed to ovulate, and during our menstrual cycle, the lining of our endometrium gets thicker and thicker with blood, and then if we don't conceive, then the endometrial lining starts to shed, and that's us having our period. But if we do conceive, then we don't shed our endometrial lining, and a baby implants in the uterus.
Okay, so how can PCOS affect this and cause problems?
Right. So how it affects it is, instead of having normal luteinizing hormone and follicle stimulating hormone, which are hormones from our brain that stimulate our ovaries to work in that cyclical pattern every month, women with PCOS have high luteinizing hormone relative to follicle stimulating hormone, and so they don't ovulate. Also, women with PCOS have insulin resistance, which is part of the picture of why they're having difficulty losing weight. And that insulin resistance can cause anovulation or difficulties in ovulating. It can increase our male hormones, our androgens called testosterone and DHEA, which can lead to some of those abnormal hair growth patterns. And then also, you can have low progesterone relative to estrogen, which is also causing that hormonal imbalance that we see with PCOS that leads to not ovulating and difficulty losing weight.
Okay. If you could pick just 1 or 2 of the most serious warning signs or the most common warning signs that would make you want to go see a doctor, what would they be?
That's a great question. If a woman isn't ovulating or menstruating basically every 30 days and she misses 3 or more periods, I would definitely go in to see a doctor. And the other is that if you are exercising regularly and eating fruits and vegetables and feel like you're overall eating pretty healthfully and you're not able to lose weight at all or to stay at your ideal body weight, then go and check in with a naturopath as well and see if we can figure out what's going on.
Okay, so if you've seen a doctor already and maybe had some tests done or some lab work, what are some things regarding that might be of concern?
So you might have high testosterone. That's definitely of concern and needs to be improved. You might show up with insulin resistance. You may show up with abnormal lipids or high cholesterol. And you may have high LH relative to FSH. And if you see anything like that on any of your labs, that's of concern and should be dealt with.
Okay.
And not ignored.
What type of tests do you run, and what type of questions do you ask that leads you to the conclusion that a woman might have PCOS?
So if a classic thing that a woman comes in with is, I'm having difficulty losing weight, I have a personal trainer that I go to twice a week, every other day I'm exercising, we go through their diet diary and they're eating excellently. They're not overeating, they're eating regular meals throughout the day, they're making good choices with the foods that they're choosing to eat, and they say, I'm having really hard time losing weight and my menstrual cycles are not normal. I'm having a period every 3 or 4 months. That right there is the ding, ding, ding for me to think about PCOS. So then I start asking, have you noticed any abnormal hair growth? How is your libido? Which for PCOS women, the one good thing about it is they usually have a really high sex drive. And then I ask them about, do you ever remember a doctor telling you that they saw cysts on your ovaries when they did an ultrasound? And they go, oh yeah, they did tell me that. And then we start to piece that all together.
Okay, that makes sense. That's quite a bit of information, so check the description and the link below this video for all the things that Dr. Naumes just mentioned, and check back for part 2 where we talk about types of treatments for PCOS. Thank you.